So, greetings, my fellow Virginians. I thought I would talk a little bit about healthcare. I was asked to opine on my position regarding access to quality healthcare in the state of Virginia. So, many of you are aware that my platform is heavily vested in economic development, and I firmly believe that healthcare is vital in support and sustainability of a market. Okay. And therefore, my thoughts are these. Like, I was asked, recently when I was out there soliciting signatures, what are my thoughts regarding healthcare and how can I basically disrupt the marketplace to make it more efficient for Virginians, and how can we shake things up to the point that um, regular Virginians, uh, underprivileged, uh, you know, community members throughout our state would have quality healthcare similar to that of the elite population of the country and obviously within the Commonwealth. So, with this said, I'm going to kind of piggyback off of my economic development experience worldwide, supporting market development, sustainability, and capacity building worldwide. So I most likely will deploy a very different strategy. I haven't quite completely uh, put everything structurally sound yet in terms of my position on how I'm going to deploy uh, healthcare privileges for all Virginians, not just the elite population of Virginia, but for all Virginians. So one of them is going to kind of be stationed on a platform where it's going to be similar to a universal healthcare system, okay, where 100% of the costs associated to healthcare will be covered by the state, and we will develop a strategy so that our state will be able to easily support those within our community that simply does not have access to quality healthcare. So we're gonna tap into certain, uh, financial and market resources in which we're going to kind of diversify the way that we invest in our economy, meaning supporting the labor market and the healthcare system within our state. So it's going to be a little bit different. As I have mentioned, the universal healthcare system, unfortunately, doesn't really work in various countries that have employed and implemented it because they haven't really looked into the capacity of the market to support universal healthcare. That's going to be different with my strategy. In the state of Virginia, we're going to be incorporating a markedly, um, how would I put this, a structure in which the market is actually benefiting by providing universal healthcare. So it's going to come out. I'm gonna roll it out sometime in the next couple of months. But one of the tiers that we're going to be deploying is universal healthcare, where people will be able to get access to quality healthcare within the state, or even out of state, or even overseas. And I'm pretty sure most of you are aware that many countries out there are already supporting Americans as they basically, tap into the healthcare system overseas. So we're going to use similar approach in terms of providing healthcare to our citizens and our fellow Virginians. All right. The second structure that I will deploy will be basically similar to the Medicaid system, in which you get a portion supported and subsidized by the government. Okay, we're going to continue to explore ways to make it more efficient and doable for those that might not qualify for a universal healthcare system. Okay, I don't want a universal system, even though it's called a universal system, that it basically would cover the whole state. There's going to be various options and prerequisites in order to qualify. So what I'm going to do is for the system similar to the Medicaid system, we will look at certain privileges that we can incorporate into that structure so that if additional service or support or funds would need to be allocated for that second tier system within the Medicaid system, we will also explore those possibilities. The third thing that I will also incorporate into the healthcare system within the state of Virginia is a structure in which the employers will benefit from supporting the healthcare structure that their companies are already offering their employees, these private healthcare systems, in which the employers are actually going to be benefiting from the structure that I'm going to be implementing on top of having their employees healthy and happy. So it's not just a system where the employee will benefit, but also the employer, and it's visible for the employer in terms of the way that we're going to support their employees through this third tier of medical services. Okay, it may come into some sort of reimbursement to the employer or certain privileges that the employer would be privileged to access, maybe in taxation or some other ways that the employer would actually see it in their pocket. Okay, because obviously we love our employers in the state of Virginia. We want more employers to come into the state of Virginia, so we're gonna want to make them happy. Okay, that's number one agenda within my overall sphere of influence within the healthcare strategy that I'm going to be deploying. So those three tiers, and I might diversify further. I might do special privileges also for children and young adults. Teenagers that are doing well in school because they're going to be our next decision makers, they're our next leaders. So we might employ strategy for high school students that accelerate in their studies, as well as college students that accelerate in their studies. We may incorporate some sort of additional added value in the healthcare system for these young Commonwealth citizens, young Virginians, basically. So stay put, folks. I appreciate the question. Thank you so much for asking these very thought-provoking and very relevant economic development questions that we will be exploring throughout the coming months that we're developing our strategy, our campaign strategy overall. So with that said, folks, thank you for watching. Take care.